Hi everybody, welcome to the Champaign County Healthcare Consumers second video in our series that we call Healthcare Fact Chat. It's a chat between me, Claudia Lennhoff, I'm the Executive Director at Champaign County Healthcare Consumers, and
Adani Sanchez, Client Services Coordinator.
And today we're going to be talking about the CBO score that came out last week on the Amended American Health Care Act, AHCA, which is also HR 1628, and that came out on May 24th, 2017. And regarding the new CBO score for that amended bill, our Representative Rodney Davis sounded really excited about the score, like it was really saying great things about the bill, and he said the new CBO score confirms that the AHCA will lower premiums and decrease the deficit. But before the AHCA came out, what was Representative Davis mostly talking about?
So he was really talking about how this was going to be great for people who had pre-existing conditions. He actually claimed that this would strengthen protections for people with pre-existing conditions. And we have actually found, I've got a quote here from the CBO report, people who are less healthy, including those with pre-existing conditions or newly acquired medical conditions, would ultimately be unable to purchase comprehensive non-group health insurance at premiums comparable to those under current law if they could purchase it at all, despite the additional funding that would be available under the American Health Care Act to help reduce premiums. So they might not even be able to get it at all. As a result, the non-group markets in those states would become unstable for people with higher than average expected healthcare costs. So this is actually going completely against the claims that he was making before the CBO score came out, which might explain some of the change of tune.
Right, yeah. So the concern about pre-existing conditions for people really came out of the idea in the American Health Care Act that there would be a waiver so that states could get this waiver. This was the MacArthur Amendment, right? States could get a waiver and they could basically waive out of the federal government's essential health benefits, which are all the things that have to be included in health insurance and are sort of set at the federal level, so that health insurance is health insurance regardless of where you live. All health insurance plans cover these like essential health benefits. And so some states, in order to reduce costs, might apply for a waiver so that they can set their own essential health benefits. And somehow Representative Davis seemed to think that that would strengthen protections for people with pre-existing conditions, but in fact it actually could be a whittling down of what a health insurance policy might actually cover.
Right.
So this is a very sort of damning statement from the CBO.
Oh yeah, and if you think that you're in a state that's safe, I mean the CBO estimates that 1 in 6 Americans live in states that would actually apply for these waivers from key ACA provisions like the essential health benefits that you were just talking about. So this means that, you know, people would be able to buy plans, but they might not necessarily cover all the things that they need under those plans.
Our take on the CBO score of the amended AHCA is basically that it's still devastating. It's perfectly consistent with prior estimates, almost perfectly consistent. The CBO estimates that the AHCA, amended AHCA, which would cost $23 million to lose coverage by 2026. 14 million of those would be in the next year alone, and then 19 million more in 2020. The bill would reverse all the historic coverage gains of the Affordable Care Act, which started in 2010. It would, of course, cut the federal Medicaid spending by $834 billion, and that's something that we talked about in our first video because that is so important to understand, that Medicaid as we know it would basically end under this American Health Care Act. But it would provide $664 billion in tax cuts to the wealthy, which is, I don't know what kind of health policy that is, but there it is. And basically, the CBO said very directly that people with pre-existing conditions would be priced out of the market. So, you know, so much for the increased protections for people with pre-existing conditions. And overall, they said that this bill would reduce the deficit by $119 billion. And now it seems like Rodney Davis, rather than talking about what happens to people with pre-existing conditions, he's talking about the budget deficit reduction as a result of this bill. And then he also said about lowering premiums for people. But we should talk about how that actually happens.
Yeah,
right?
Health insurance becomes cheaper when you don't have to cover things like lab services or prescriptions. And it becomes really cheap to buy health insurance plans that don't cover those really big things, those expensive things.
Right.
So that's how. That is fair. That is a true thing. Insurance premiums might go down.
Yeah.
But it might just not cover the things that you need. You might have to make more money to pay for those services that you now can't get covered under your health
out
insurance.
of pocket. Although the CBO does says that the American Health Care Act would first increase premiums before 2020 by an average of 20% in 2018. So premiums would go up first before they go down. And then they say that the average premiums for insurance purchased individually would be lower in large part because the insurance, on average, would pay for a smaller proportion of the healthcare costs, which is exactly what you were just explaining, because of those waivers in states and insurance companies not having to cover as much.
Another part of the waivers that I think is really important to talk about is that another requirement that the ACA has is that they charge older people they can only charge older people so much more than younger people.
Right.
And one of the things that states can apply for is a waiver that they can charge older people up to 5 times as much. So right now it's a 3-to-1 ratio, and a state could apply for a waiver to charge older people more. So not only is the lower insurance premiums after a while, that's actually not going to be true if you're older, potentially, if your state decides to apply for one of these waivers.
Yeah.
So you're really out of luck if you're unhealthy and have a pre-existing condition and you're already older, so your health insurance premiums might already be more expensive.
Yeah, so all the analysts who we follow and the CBO, also basically conclude that the American Health Care Act works the best for wealthy 21-year-olds. So if you're 21 and you earn $75,000 a year, or under, maybe just under $75,000, so you can get your $2,000, tax credit, congratulations, you're a winner in this. And then as far as the focus on the deficit, which I think is interesting because I don't think that when Rodney Davis was talking about the American Health Care Act earlier, or how bad he thinks the ACA is, I don't think that there was a lot of talk about the budget deficit. I don't really know what that has to do with health policy, but he's excited that it's cutting the budget deficit. Well, the CBO says that the largest increases in the budget deficit under this bill would actually come from the tax cuts for the wealthy. So I think if your real interest is in cutting the budget deficit, you get rid of those tax cuts for the wealthy, and then maybe you don't have to cut Medicaid, and to pay for those tax cuts.
That doesn't make a lot of sense.
No.
That doesn't make a lot of sense at all.
Basically, the CBO report shows what it showed earlier. There is very little improvement. If there's actually really no improvement, it just changes around what some of the numbers are in terms of reducing the budget deficit and things like that. But it's still a horrible bill, and any decreases in health insurance premiums will come about as a result of watered down health insurance policies, and that's not good for anybody. This is the American Health Care Act is simply a terrible bill, and we just have to try to keep these legislators from spinning the CBO report as if it's somehow a good thing. It is really not a good thing.
No, this doesn't change anything about the core bill and the core problems that were kind of wrong with the bill.
Yeah.
That still many stakeholders and actually insurance company CEOs have kind of talked about being really problematic to the markets.
Yeah. So, in conclusion, the amended American Health Care Act continues to be essentially a tax cut bill for the very wealthy, masquerading as a health care bill. There is no health policy in this bill that actually improves people's lives.
Thank you.
Thank you.